Hello everyone. Today we are going to discuss the hemophilia. So what is hemophilia? It is basically deficiency of coagulation factors. If the 8th factor is deficient, it is known as the classic disease, and if the 9th factor is deficient, it is known as Christmas disease. It is X-linked recessive disease, that is, it almost exclusively occurs in the males. The patient will present with the clinical features of bleeding, and the bleeding in joint, it is known as the hemarthrosis. So what is the pathology behind the radiologic finding? There will be initial bleeding episodes. Now these can resolve, but if there are repeated episodes of hemarthrosis, it will lead to synovial proliferation, which is also known as the pannus formation. Now this pannus formation will lead to deposition of hemosiderin around the joint, and secondly, it will lead to articular adhesion and the fibrosis, which will finally lead to destruction of this articular cartilage, and we get the degenerative changes in the form of sclerosis, cyst or osteoporosis. Now let us see the finding on the X-ray. Now here this is the X-ray knee AP view. The first thing we see is that these condyles are quite enlarged and the trabeculae are quite prominent, which are suggesting osteoporotic changes. The articular surfaces are irregular and they are flattened. We see the widened intercondylar notch. Similar changes are seen in the tibial bone. So why we get these changes? The first thing, the epiphyseal abnormalities. So there is chronic hyperemia of the epiphyseal cartilage, and this leads to the accelerated growth and maturation of epiphyses, due to which we get these enlarged epiphyses. Secondly, why we get osteoporotic changes? So initially we get the osteoporosis due to hyperemia, and later when the patient is inactive, there will be accentuated osteoporotic changes. The subchondral bone cyst, the subchondral means it will be beneath the articular cortex, and radiologically we will see the well-defined radiolucency. These radiolucency either occur due to synovial fluid accumulation or due to the localized hemorrhage. Now let us see the changes on the X-ray knee lateral view. Here we see two additional findings. Firstly, see this patella. Normally, the patellar inferior pole, it is tapered at the apex, but here we see it is flattened, or we say the squared configuration of the inferior pole of patella. So why we get this squared inferior pole of configuration of the patella? Actually, due to the repeated hemorrhage, it will lead to the inhibition of the secondary growth center of the patella, and it will lead to the squared configuration. As we have learnt, hemosiderin deposition also occur around the joint, and this is the hemosiderin deposition. One more finding is that sometimes we get the hemophilic pseudo tumor formation. See in this ileum, this is the pseudo tumor formation in the ileum bone. So it is a expansile bone lesion. Why it occurs? It occurs due to the repeated intraosseous hemorrhage. Its appearance can vary. It can either appear as small benign lesion, and in this case, as we have seen, it can either appear as large aggressive lesion. The most common sites that we see are the femur, the pelvis, tibia and the hand. So we need to see the associated feature to diagnose the hemophilic pseudotumor. Thank you everyone. If you liked the video, kindly subscribe and comment.